It is right now, right at 10 o'clock. And because we have so many questions and so many things to cover right now with all of our panelists, I think we will go ahead and get started. Good morning. My name is Bettina Drake. I'm a professor in the Division of Public Health Sciences and Associate Director of Community Outreach and Engagement at Siteman Cancer Center. I want to welcome all of you to Siteman Cancer Center's virtual town hall addressing disparities in COVID-19 and cancer. This is sponsored by the Program for the Elimination of Cancer Disparities. And while we know this virus spreads indiscriminately, it also exacerbates our existing social disparities. And I know we've all felt the impact in some way of this virus on ourselves or those close to us. And after close to 3 months of social or physical distancing, and we're now approaching the reopening date for St. Louis County, I'm sure many of you have questions. In fact, the reason for this town hall is to answer questions that we've heard from our patients and from our community partners at Siteman. And we want to know, people want to know, what is the impact that this virus has on our cancer patients and cancer survivors? And how do we continue to stay healthy physically and mentally and emotionally during this time? We have a panel of experts here today who will specifically address each of these questions, as well as more broad questions any of you have on COVID-19. I ask that you will mute your microphones, and as more people add, possibly turn off your cameras except for our panelists to make sure that we don't have any internet issues. And if you have questions, if you could use the chat feature at the bottom of the screen there. If you type in your questions, I will be monitoring those, and we'll make sure to ask those questions of our panelists. So I'm going to do a quick introduction for each of our panelists and then present an introductory question for each of them, and then we will open it up for additional questions from all of the other attendees. So first we have Dr. Graham Colditz, who is an internationally recognized leader in cancer prevention and cancer epidemiology. He is a professor in the School of Medicine at Washington University and chief of the Division of Public Health Sciences and deputy director of the Institute of Public Health and associate director for prevention and control at Siteman Cancer Center. He's also an integral member of a number of the COVID-19 epidemiology projects that are currently underway in the region, as well as at the university. We also have Dr. Gladys Smith, who is a licensed psychotherapist. She's a licensed clinical mental health counselor and a registered yoga teacher. Dr. Smith is an approved clinical supervisor and currently serves as a trauma therapist at Washington University Medical School. We also have Dr. Arnold Bullock, who is a professor of urologic surgery at Washington University School of Medicine and Siteman Cancer Center. His clinical expertise is focused in prostate, bladder, and penile cancer, and he treats patients at a number of sites of Siteman Cancer Center satellite sites, including North County, as well as the main location. Dr. Ryan Fields is professor and chief of the section of surgical oncology in Washington University School of Medicine and Siteman Cancer Center. His clinical and research interests are in the care of patients with tumors of the pancreas, liver, stomach, and small intestines. And he has been involved in the planning and conduct of care of cancer patients at Siteman Cancer Center, and including those with COVID-19. We also have Ms. Angela Fleming Brown, who is the CEO of the St. Louis Regional Health Commission. Prior to becoming CEO, she served with the Regional Health Commission as the Strategic Planning Associate for the Eastern Region's Behavioral Health Initiative and was instrumental in developing Gateway to Health. Through the RHC, she works closely with Prepare STL, and Prepare STL is a collaborative campaign powered by the Missouri Foundation for Health in partnership with the Regional Health Commission, the city and county health departments, and other community health organizations to help prepare St. Louis for the effects of COVID-19, how to stop its spread, and how to survive the pandemic physically, emotionally, and economically. So we want to get started with a first question to Dr. Colditz. So, Dr. Colditz, You will turn on your audio there.
I
Great.
thank you
Thanks.
so much, Bettina. Um, the
So
update on the state of COVID here in St. Louis. Um, at the simplest level, while number of infections per day is going down across most of the state, St. Louis metropolitan area has not had as much reduction. We know that the burden of COVID, as in other parts of the country, is most extreme in the African American population. Men and those with multiple comorbidities have the most severe complications of infection, more likely to be admitted to intensive care and have a higher risk of dying from the COVID infection. So the challenge that we're all facing, and the National Cancer Institute is supporting these efforts here and elsewhere, is to really quantify just how big this impact of COVID infection is on the treatment and outcomes for patients with cancer, and equally is COVID reducing the likelihood that people in the community are following their routine screening practices, mammography, colon screening, pap smears, and so on. The local and national impression is, yes, of course, we've shut down mammography. Colonoscopy's been an elective procedure. So there is expectation that this delay of preventive services can translate to more cancer, more advanced cancer, and long-term poorer outcomes. And Ryan and others can talk to the effort that Siteman is pursuing to bring screening and preventive services back online across the satellite and main campus to um, curtail this impact. The research that Bettina has mentioned is starting to ask, we may open up mammography, but are women going to want to come? We can open up colon screening, even with the safe practices that will be in place. Is the community ready to go back to that scheduled mammogram that was on the books for July? Will that actually still take place? And so there will be continuing data collection to really quantify the impact of this virus and the pandemic locally and then nationally on the delay in diagnosis and ultimately that impact on cancer outcomes. Thanks, Bettina.
right. And Dr. Smith, what have you been seeing in terms of mental health right now in the patients you're seeing, and how is COVID-19 affecting us?
Well, I've seen a variety of individuals. I see the students during the daytime, and I'm on a given hour program. And so I get a chance to treat and see patients who are nurses and lab technicians and some physicians in Connecticut, in New York, and Illinois. And then I see locally some people. So it's really interesting how the variance of symptoms and just what people are experiencing. Everything from depression to anxiety to re-traumatization to fear. I look at it as collective trauma and collective grief. So it's a wide variance of things. People are impacted by the isolation. They're impacted by the information that they're receiving. And so the sense of prevailing fear, depression, anxiety, panic attacks, isolation, domestic violence, intimate partner violence, just a wide range of things I've seen just since the first beginning of all of this, all the way up until today.
Are there a couple of tips that you possibly could give us in how we can address some of these things?
Oh, sure. The first one is this virus has affected our ability to breathe. You know, we need assistance in breathing. The one simple thing that each one of us can do is just embrace ourselves, which includes the touch, and to just breathe for a few minutes. It's really difficult to breathe in the past and very hard to breathe in the present. But the thing that we have right now is the present. If you could just embrace the present, taking your time, it allows you to think a little bit clearer, because the whole thing affects our central nervous system. You know, we want to eventually, well, immediately go into sympathetic, where we're raving. We want an answer. We want to know what to do. But just taking a simple breath is the simplest first thing that you can do, because it slows you down and then puts you in parasympathetic dominance and allows you to think a little bit more clear. So then you can ask for help. You can acknowledge where you are first. So those are just some simple beginnings. And 211, if you think that you need help here in Missouri, and BHR is available. The two simplest things, you can dial 211 or you can Google BHR, and the services are free and they're available 24/7 for individuals.
Thank you. That's very helpful. So I want to turn to our two clinicians that we have on a panel, Dr. Bullock and Dr. Fields. What are some of the cancer-related services that are currently being offered at all of Siteman Cancer Center satellite sites, including Christian Hospital up in North County? What's been put on hold? What's still going on? How can patients reschedule treatments or other services?
Well, I can comment on a number of those and then let Dr. Bullock weigh in as well. First, thank you, Bettina, for including me, and Dr. Kolditz and everyone. I hope everyone's safe and well. I guess the easy way to answer that is right now, especially now this week and going into next week, there are really no services that aren't being offered in terms of treatment, in terms of scheduling appointments, in terms of coming in for follow-up visits. And what I'll sort of really couch that on is treatment of patients that have active cancers that need treatment. Now, the one caveat I will say is we have tried to limit the number of in-person visits for patients, say, that are coming in for follow-up, where they may be asymptomatic and doing well, but are due for a CAT scan or a PET scan. And for a lot of those, we're having the patients still come in for their scan, but then instead of coming back up to the clinic, we're doing telemedicine visits, and we're doing a lot of these visits for both new and established patients to try to minimize the in-person interactions and respect the social distancing guidelines. And that's been a big success. The one thing I would really like to emphasize, and a good, I think, take-home message is we at the Cancer Center from top to bottom have tried to make it as safe as possible to come into the medical center. It's there's a lot of screening that goes on if you show up at the front door in terms of temperature checks and questionnaires. You get called before and after visits to make sure that you're doing well and not having symptoms that would preclude you from coming in. And there's also, for patients that are coming in for active treatment, a lot of testing. For example, if I have a patient with a cancer that needs a treatment in the operating room, those patients all get tested for COVID-19 before coming to the medical center. And as of this morning, we have not had a single case of a hospital-acquired COVID infection from an asymptomatic patient coming into the medical center. So I think that's good news, and that really speaks to how critically everybody's really trying to think of keeping everybody safe and protected during this time. So it's not perfect, but I think the message that I'd really like to relay, and happy to answer questions about it as well, is that it is safe to come into the medical center when you need it. You should be in touch with your physicians if you have a new problem or you have an existing problem and have a question, and they can really guide you. And I'd love to get Dr. Bullock's perspective on things.
Thank you, Dr. Fields. I'd like to reiterate a lot that's already been said. We had basically shut down most of the hospital services except for true emergencies for the past 5 or 6 weeks or so. But if you look behind Dr. Fields, you'll see how large this institution is. And that's in order to hold a lot of fairly smart researchers and epidemiologists and other specialists who've been able to look at the data and have elected, reasonably so, that it's time to get back to not just the emergency medical services, but just medical services in general. Of course, the more urgent, more so than the elective. I do a lot of penile implants, and we're not ready to do those. But certainly, it's been a compromise between the risk of infection versus the risk of cancer progression. And especially in the African American communities, and if I speak to the diseases that I'm most familiar with, kidney cancer, bladder cancer, prostate cancer, for years we have recognized that the disparity in cancer outcomes between African Americans and other populations has been in part due to delay in cancer treatment. And so we can't say that 8 months ago, we really find it very important to treat cancer as soon as reasonable, and now say we can delay 4 or 6 months for many of our cancers that are life-threatening. And so I'd like to reiterate what Dr. Fields has said, is that I don't want to catch the disease. Of course, I don't want to contract the disease, but I have been there all along with many of my colleagues, and we find it safe. We screen all of the patients. First of all, patients coming into the outpatient surgical areas are coming into a clean area. Not only are the patients screened, but everyone walking into the hospital is screened. They leave from the operating room to a clean recovery room and then go to a surgical floor. And the surgical floors are quite distant than the floors that are harboring the patients who are with the Corona-19. So right now, I'm comfortable operating. I would suggest that my patients, the risk-benefit ratio is far toward management of essential medical problems, more so than the viral disease at this point.
Thank you for that. And one quick update, we did hear from the Breast Health Center at Siteman just yesterday that the mobile mammography van will start to go back out starting on May 26th. And they have their schedule ready for following weekends for that. So keep your eye out on the website and their Siteman's Facebook page for all of those dates where the MAM van will be. I want to turn to Angela Fleming-Brown. Can you talk a little bit about are for people in the St. Louis region around COVID-19?
Sorry, Bettina, you went out a little bit, but I think you asked about Prepare STL.
I did.
Yes, so I will speak to that. Good morning, everyone. Bettina mentioned that Prepare STL is definitely a collaborative effort of community organizations in partnership with our city and county public health departments to raise awareness to COVID, as well as to amplify resources that are available to individuals that has been targeted to many of our high poverty, low income, high poverty, high level of chronic disease areas in St. Louis City and St. Louis County. This initiative was started maybe 2 months ago, and at the beginning of the year, at the beginning of April, we had canvassers that went out into communities, really targeting those zip codes that have high levels of infection in North City and North County, to visit some community hotspots that are still open, like our grocery stores, gas stations, and other places of the such, to put out information that talks about how to slow the spread of the virus, as well as to help people understand how to survive this virus during this time. And one of the things that has made this initiative so impactful is the community input and engagement that we have been able to have through this initiative. When I talk about our canvassers, they are people who live in the communities that we're targeting. They're their neighbors. They shop in many of the stores and things that we are targeting as well through this initiative. And so they know the community and they feel empowered and really wanted to help their neighbors and their friends be able to survive the virus. And so really their input is what helped design this initiative, came up with the name as well as the process that we've been able to engage. One of the things that has made this initiative impactful is that we have this kind of 3 crucial elements that we've been working through and kind of developed our model for how to go out and raise awareness to this disease in our community. The first one has been the public health education component. So it is a traditional communications campaign where we have media as well as TV ads, radio, as well as social media campaign. But then through the canvassing efforts, we have individuals who are in the community, and they're not just putting out signs, but they're also able to observe what's going on in the community. And from their initial observations, one of the things that they noticed as they were going to the stores, that although many of the stores may have soap, protection, personal protection equipment, like the face mask or gloves, that many of the workers did not have those materials. And so they were working without access to the things that they needed to protect themselves. And then they also noticed that many of the people that were shopping and were out were not practicing social distancing and did not have masks as well. And so part of the second part of the campaign became to do virus protection. And so we started doing PPE distributions. So as our canvassers went out, they were strapped with PPE kits that they can give to employees that may be working where we thought they really needed access to those materials as they were engaging with customers. And then we've also partnered with the Urban League and several other community organizations to give away PPE kits. And to date, we've given over 11,000 PPE kits to the communities. And as we kind of move into the reopening phase of our community, we are hopefully having a really huge face mask giveaway. We have a big campaign to try to get cloth masks because we know individuals will need this for the long term as we look to kind of moving into our new normal for our environment. So that's the next phase of the work. And then the third element that has made this work so impactful is the economic relief. So when I talk about the canvassers are from the community, many of them have also experienced a lot of the hardship that has resulted from us being shelter in place. So about 70% were unemployed because of COVID. And so as they are volunteers for our canvassing efforts, they do receive a gift card worth $360 for their time and efforts. And also understanding this is a very unique high-risk time that we definitely want to compensate them. And so we're able to reinvest in our community members that have definitely been impacted by this pandemic, like many of our community members. And so those 3 components is what makes, I think, Prepare STL so unique and helpful to our community. The public awareness, the community protection, as well as the income. And so while we started in the African American community, we target that community first because we know, as we've heard previously, about the impact that they've had from disease. This week we'll be out in the immigrant New American population, and as well as next week we'll be doing some canvassing and distributing of PPE kits to our early childhood care centers, realizing that many of them have been working during this time without access to masks or the information they needed to understand how to stop the spread. And so just really trying to gear up to make sure our community is able to not only stop the spread, but definitely survive this pandemic and crisis.
Thank you, Angela. So how does someone reach out to you if they need some of those services, such as the PPE?
So definitely you can go visit preparestl.com and visit there. We also have a partnership with 211 that Gladys mentioned. So any type of support you need, we do highlight that 211 is available. And through our networks with IHN, they have community referral coordinators are able to assist people that are calling from our area. So those are definitely ways to reach out and find out more. And then if you're on social media, follow us definitely on a Facebook page for Prepare STL, where we post a lot of the giveaways as well as other resources that are available in our community.
Thank you. So I'm turning to a couple of the questions in the chat box between Sal Valdez and Dr. Kolditz. You probably answered a little bit of his question, but I want to give Dr. Kolditz a chance maybe to share that with the group, the concern or the question was about COVID-19 data in the St. Louis metro area for Latinos and other immigrant populations, and how is that data being collected currently?
So the Hispanic and immigrant populations are obviously part of our community, 3 to 5% total. And so my understanding is some of these data are collected but have not been broken out. And so I put in my note back to Sal that we could push the data team at the Institute for Public Health who've been accessing all these data to at least give us a sense of where the situation is locally. We know nationally these populations are at increased risk of both infection and complications from infection.
Thank you. There's another question from Julie Poole with Food Outreach. She's expressing that they have seen a drop in cancer patients referrals to them who are looking. Food Outreach provides nutrition at no charge. And she's curious as who should she work with to help address these patient vulnerabilities and nutritional needs? That could be any of the panelists.
Is Ryan Fields. I mean, I think there are probably a number of resources through the Cancer Center that we could work with in the different tumor programs that would be able to help with that. Because I agree, you know, some of the what you're seeing as a drop may also be reflected by, you know, the fact that in really March, April, May, we're seeing 25 to 30% drops in our volume of new referrals and new patients as well, that we expect to start to sort of jump back up. But I can provide some names of some of the resources within the Cancer Center itself that may be able to help identify and make available some of the services, the nutrition services that you have. And I think that would be obviously very helpful, especially the patients that have that particular need.
I must admit that if I had the references to these resources, I'm familiar with several support groups for at least urologic cancers that I could forward on to the representatives of those groups. One is online with us, Robin Wright Jones, who's with the Empowerment Network. You know, again, by distributing the information to at least the administrators or heads of these social groups. Cheryl Jackson, I see, is also on this webcam, if that's what we call it. You know, I think that they have members of their groups and they're familiar with other groups, that this chain of activity would be one good way of just passing on this information in terms of what's available.
Yeah, I think that's so true. The Clergy Coalition, and as Angela mentioned, the Urban League, many of the individual churches are offering feeding for many of the communities. I know our churches, St. James AME and the Ville, there are a number of churches that are just feeding people, but it's like you said, it is connecting the dots to the individuals that need it and in the community and outside of the community. And that's why this is really important, so that we can connect.
I do want to say I'm president of the Breakfast Club, and we are, even though we're not able to meet face to face, we still are continuing to have our monthly meetings by conference phone. And we are keeping up. We have a calling committee, so we're keeping up with our members and new members who need buddies and still need services. And we work closely with Gateway to Hope, so we could still also offer some financial services. So we are on the website. We're having our website redesigned right now, but we are providing the services we can. I attend Centennial Christian Church, and we still have, even through this COVID-19 time, we still are offering the food pantry twice a month, 2nd and the 4th. And we're doing lighthouse lunches for the kids on Wednesdays and Fridays. So that's certainly a resource that you can take advantage of. And People's Health Center is also offering food on every Friday this month at 5701 Delmar.
That's fantastic. That's fantastic. I love this presentation. I know Dr. Koldwitz, and I know I didn't mean to put you on the spot, but I have to ask those questions. My questions are not meant to be antagonistic. They're meant to help us frame the questions around COVID and other health disparities in a conversation that is both inclusive and equitable for all of our communities. Too often our immigrant communities, and I understand the historical discrimination and the history of our African communities, brothers and sisters. I do. But too often it becomes a black and white issue. And I'm saying that to be honest. And if I weren't here on this committee, nobody, I don't think, would have touched on our immigrants, our ethnic communities, and issues, language access. And we've been working with many communities, and we've gotten some changes out in St. Louis County, utilizing their Google toolbar, and that's, so there are a lot of people in our language communities, especially, that are suffering.
I agree, Sal.
And we suffer as a collective. That's all I'm saying. Because if we don't
Right.
take up all of our communities, we all suffer as a collective. So I'll get off the stool.
No, we appreciate your input. And I was going to go to the next question, which I think is related to this. There are a number of efforts. As I mentioned earlier on, part of the reason for this town hall was to address the disparities that have been exacerbated by COVID-19 and how we are looking at the services that are provided through an equity lens. And I think for sure, maybe Dr. Koldis could address some of how projects are being designed, thinking about equity, and possibly Angela Brown could even comment a little bit on how services are being provided throughout the region, focused not just on African Americans, but a wide range of racial ethnic groups, with a number of materials being translated into a number of languages as well. And I'm sure there are other things that some of our panelists would like to talk about addressing.
So thanks, Bettina. I might just mention the county RFA and the effort to bring a team together to both respond to the county around a prevalence set of testing for both infection and past infection, 2 different tests being needed. But in entering that discussion, one of the equity issues that we had on the table from the very beginning was the actual management and support for those who test positive. It's fine to say public health wants to be increasing testing, but have we really got the support package in place for those who test positive and then are by the design advised to quarantine for 14 days? What are the resources they need to effectively do this? And that has been a real core of the discussion Bettina and others here have been in from the beginning, as we've talked of the ramp up of surveillance, not just for the county in this first piece, but working with IHN, the Regional Health Commission, and others to think, how does this become an integrated support and more equitable across the region? And maybe, Angela, you want to add to that, because you've in a way been ahead of us with the things you were talking about earlier with the Prepare STL, really setting a bar high to get the resources to the whole population.
Sure. definitely want to add, just to respond to some of the data that's available, race data. And there was definitely a slow uptick of many of our providers reporting by race. But I do want to highlight that definitely the city and the county's website have all of their data disaggregated by race. So there is some data there. It looks like they have some Asian and some other racial groups available. So definitely please go and check that data out that's available on their website. But in terms of, I think, some of our immigrant and new American populations, with Prepares TL, our website, it can be translated over 10 different languages, as well as our flyer. And as we get ready to do our outreach into the immigrant and new American populations, and we're looking at several different, particularly our African, Spanish, Bosnian, Vietnamese groups, we did have to do some different strategies than we implemented for our African American groups because of the way this community, I think, is able to receive information, where we were using 211 for our other flyers. We did have to change that because when you even call 211, the prompts are in English. And so thinking through some of that strategy of how that people who completely don't understand English or cannot speak in English, what resources were available to those individuals. And we did find it to be very limited. So we were thankful for organizations like CASA, the International Institute, and there is one more that I'm forgetting, but where people are able to call and they actually then do a connection to the testing sites to help them translate for many of our immigrant and new American population. So we have been doing some new partnerships, even thinking about how do we hire workers and canvassing, really being more strategic. And so one of the benefits, I think, of Prepares TL is that we try to recruit people from the communities that we're targeting. And so we have recruited volunteers from our non-English speaking communities, as well as some of the new American and immigrant groups, to have them be a part of the canvassing work, so because they know the different places where people go, and where they know where it's more effective to really get this information out to these groups. And so we're out there, we're doing the same giveaway in terms of face masks and PPE with that population as well. And so I think while we don't necessarily always think about it, because of, the African American is so impactful, because when the city first came out, all of their deaths were African American. And even to this date, they still represent majority of the deaths that have been seen from COVID-19. And that's one of the reasons I think we have seen the highlight around that population here in more conversation, but definitely don't take for granted the lack of information that's been given to our immigrant and new American populations. And in terms of equity and race equity, as well as health equity, I think if nothing else, this pandemic and crisis has definitely highlighted the need for us to be more intentional about moving and operating from a racial equity lens in all of our work. And so that's why we stress the importance of having that race data to really determine strategies and efforts, and really to amplify the community voice and how we're making decisions. And so we think about testing sites that were available in our community and the way they were implemented. And we see African Americans have been impacted, testing sites were their last. And so really thinking, as we look to the future, how do we have that racial equity lens when we're thinking about what to do and how do we serve people, is a large part of our hope that this community can move towards as we think about the new normal that we're walking into.
Great. Thank you.
No problem.
Another question that we got ahead of time was, we know the stay-at-home orders are going to be lifted soon, and we need reliable access to testing and possibly antibody testing. What is the difference between the coronavirus test and an antibody test, and how reliable is the antibody test, and why are these tests so important to be reopened? There's a couple of questions there.
So I can chat a little bit about the testing side of things. Kind of separate them into two categories. The first, or the real COVID test, the PCR test, the one where they swab your nasal cavity or sometimes in your mouth for saliva, is determined to test if you have the active infection. So that's used for patients that are symptomatic or patients that are being screened before a procedure. That's separate from the antibody tests that test if you may have been exposed to the virus in the past and may now have some degree of immunity. And for other viral illnesses, we have a long history of being able to correlate having a positive antibody test with developed immunity. With this virus, we've only known about this virus for 6 or 7 months, so we don't know what a positive antibody test means, but people are very hopeful that it means that people would have some degree of immunity and would not be then able to become reinfected and have the clinical syndrome again. Now, the important thing about the antibody tests is there have been over 80 antibody tests developed and submitted to the FDA. And really, there's only 2 that, in my mind and the minds of a lot of the ID experts, are good enough for prime time and have been tested and validated enough, because anybody on this call could go to their garage right now and develop an antibody test and submit it to the FDA for approval. But some of the bigger companies that have a lot of experience with this, Roche and Abbott, are the 2 that really have well-developed tests that have low rates of giving false results. So over the course of the next several months, we will probably know more what a positive antibody test means, who should get those tests. Will it mean that those people can then go back to work and into society without fear of becoming reinfected? So those are kind of the 2 separate categories.
So some people might be leery about something that came out in the national news over the last couple of days, which suggested that the testing that is being done for the virus at the White House even has a very, very high false negative rate. False negative means that people might be infected, but the test is not accurately detecting the presence of the virus. And it could be a problem with the test that is being done on those individuals. It could be that there might be different strains of the virus, which possibly leads to such a variation in clinical response to or outcomes from it. But I agree with what Dr. Fields was saying. You can imagine the amount of money being poured into and the amount of effort that universities are directing toward this cause to come up with more accurate testing, to validate the tests that are out there, and to increase the number of tests that are available. And that's one of the challenges. What is the presence? What's the percentage of people in our community who have been exposed? What's the percentage of people in our community who've been exposed and were clinically asymptomatic? And until we have further testing of the actual presence of the virus and further testing of a larger population of those who have antibody response, we still are somewhat in the dark.
So one of the things we know is that if you are immunocompromised, it puts you at increased risk if you have the virus to have negative outcomes or poor outcomes from the virus. What does that mean to be immunocompromised? And cancer patients fall into this category? Or what are the other groups that fall into this category? And is it okay for those individuals to continue to work once the shelter ban has been lifted?
I'm not sure if Dr. Fields left. Dr.
He's
Coates?
here.
Okay.
Oh, I'm still here.
So, well, again, I'm a urologist, so I'll tell you what I know as a physician. Immunocompromised means that our immune system, immune antibodies, different types of antibodies that we're able to formulate in our body in response to infection and response to trauma. That's the mainstay of how we ward off infections. That's the mainstay of why if we, cut ourselves on a dirty nail, our hand doesn't get infected and fall off. So if you have a disease state where your immune system fails to react to that pathogen meaning bug, something that's foreign, something that could hurt you, then we're at risk. We're at risk from common infections, and we're at risk from potentially lethal infections. And so those who are immunocompromised, and that would include people who are immunocompromised due to disease or immunocompromised due to medications, such as post-transplant individuals, should have a different hunker down, social distancing rules, somewhat consistent with that of an older person. Let's say my 80-some-odd-year-old mom. Even my brother who lives around the corner, he delivers food to the door. My mom leaves any non-perishable food out on the porch overnight or a day or two before she brings it in the house. I don't do that. I think that might be a little bit overkill, but it tells you the degree of anxiety people have.
So, I mean, I would echo Dr. Bullock's sentiments in that, there are a certain population that are immunocompromised due to a number of reasons, cancer included. And it's also very different. There can be different types of immunocompromise based on different types of chemotherapy or immune therapy or cancer-related therapies. So the short answer to that is there may be very patient and case-specific recommendations for people based on their situation and when they're receiving treatments and how often that they may be advised to take different precautions than the general public related to coronavirus. So what we've recommended is there's not going to be a blanket answer to that. It's going to be, between you and your doctor and your team, they may advise different things, different measures, both for coming in for medical visits, but also for maneuvers to do at home or in society that may address that risk.
And so if I am someone who is immunocompromised, what should I do if someone in my household has been diagnosed with COVID-19? And are there currently resources that people can reach out to help them keep themselves healthy?
I would like to.
The first thing is talk to your doctor and your care providers, because they're probably going to want to be tested and quarantined. There's no prophylactic real medication or maneuvers. And then, we advise most patients, if they're asymptomatic or minimally symptomatic, they stay at home. We don't want to bring somebody into the medical center for COVID-related treatment unless they really need to be in the hospital, and that is for supplemental oxygen or ventilator support if they were to get very sick. And I think there are a number of resources through Washington University and the Cancer Center in general in terms of hotlines and phone numbers to call for questions like that, especially suspected COVID infections of family members or contacts, things like that. And Dr. Bullock, sorry to cut you off.
No. As a urologist, again, some of this is outside my area of expertise, but I still see the challenges because I'm in community. I work a lot at Christian Hospital, but the challenge is someone who has the symptoms of the disease. And the challenge is still with the availability of testing. It's improved over the last month, but it's still a challenge. A person might show up for testing, but they may not be sick enough to warrant potential hospitalization. Many of these people have been turned away. And so you can imagine in certain populations, that person is home and their home may not be like, honestly, like my home. If someone in my house was infected, I'd put them in the office. A separate part of the house, and we could bring food and drop it off. But imagine a home that there are no parts of the house that are vacant. And so that person is potentially infected, and the odds of the other family members getting infected is quite high. So it is a real challenge in our community, those people who might be infected, even if they were tested and proven to be infected, but they don't have illness enough to warrant hospitalization. Social distancing in a home with one bathroom and numerous people in a home is a real challenge. And so that's the state of the extent of the problem.
Angela, are there messaging that Prepare STL is putting out about this, or any additional resources or recommendations for people on this question?
I definitely agree with both Dr. Fields and Dr. Bullock about the challenges of testing. So they currently have the St. Louis Pandemic Task Force And some of the next phase of work that we'll be looking at is testing across the community, because we understand, and I think the group understands the need for more testing. And so there are advocacy efforts that will be going to the state to try to get more testing available in our region. I think we've talked about the shortage of testing that's available, which has made the guidelines for individuals to be tested very, very stringent. And so many people are being turned away if they're not sick enough. But there is some movement at many of our community health centers. So places like Affinia Healthcare, they're doing mobile testing, and some of the CDC guidelines have allowed for people who have no symptoms to start being tested. Asymptomatic people, as well as those who just have some light, if they're high risk, so if they're located in the high risk community, they are getting more tests to be able to target some of those groups. So there is some movement to try to get more tests in our community, but definitely a huge challenge. And some of the direction has been just assume if you have symptoms that you have it and try to quarantine. And I have a 2-year-old, so I definitely understand the challenges of trying to quarantine with kids and people in the home. So it does make for that. And we've heard of people dying at home. So the impact of disease is definitely very hard and impactful to a lot of individuals. And we're just trying to amplify those advocacy efforts to get more testing to our region.
Thank you. Another category of questions that we had was about contact tracing. Like, what is contact tracing and how important is it to managing the spread of COVID-19?
So Bettina, I could answer that from the sort of fundamental public health principle for infectious diseases is to identify the people who've had sufficient contact to be at risk of infection. So assembling the list of those who've been in contact with an infected person and then getting those people tested. And of course, like the patient with the positive that starts the process, anyone who then tests positive is advised to be quarantined. This has worked really well in some parts of the world. We heard Korea and Australia and New Zealand got on this very early on and in essence managed the spread of disease. We started very late with testing and have a shortage of person power to actually do the contact tracing. And as I mentioned earlier, one of our frustrations is the point that Dr. Bullock was just getting to, the challenge of quarantine and isolation is not equally available to everyone. So we can't, as a public health system, expect that everyone has equal access. And I don't think we've collectively solved the challenge of the resources that people actually need if they're going to quarantine, take 14 days off work, less income, food, and so on for the whole house that might be dependent on them. And so the public health response has been very much in the technical contact tracing, and we need to take a broader, equitable, and real world set of issues to the table as we make this work. But the goal is to cut down on transmission, which obviously then saves the whole burden of infection and hospitalization for that small subset who get severely ill with the COVID infection.
Great. Thank you. And I think that's definitely something that our health departments are looking to do as people are being diagnosed with COVID-19, to do appropriate contact tracing. We have time for maybe about one more question. And I just had one pop up to Dr. Smith to discuss the severity of anxiety, mental health issues that you've seen and resources available.
Sure. I was like, oh, I gotta say something. I gotta get this in, and because it is physical and mental, the two go together. You know, the doctor talked about the adrenal gland, and all of that. Anxiety is very high, so it's all in the body, and so what I've tried to educate people on is the impact and what anxiety is. What is it? It's fear. It's fear, not knowing what the future is and trying to figure it out. And so this whole thing is about fear, because it's about us not knowing what's next. But one things with anxiety is that oftentimes people will think that they've got it licked and I got it under control. And then something comes like this, bam, like what? I can get it through breathing. What? I can get it through my eyes. So it's understanding your fear, acknowledging the fear, and that's what handling anxiety is. And then how can I serve myself with knowing that I'm afraid of this? What's my next step? And it's really hard getting people to that sometimes, because it's hard letting go of that. So we teach them about their window of tolerance. Sometimes, grandma used to say, you get on my last nerve. We all really do have a last nerve. We just have to figure out what it is. And, anxiety training and anxiety moderation, emotional regulation includes knowing what your baseline is, knowing if you are hyper vigilant, where you get excited all the time and you just want to know the answer and you can't think, or if you're the hypo type of person that's kind of low and that doesn't move. And the interesting thing about this virus and how it's impacted us emotionally is that it's a roller coaster. So the first thing is understanding where you are on the roller coaster for people, and then reaching out to people in the home, if you're in the home with somebody. And if you're not in the home with somebody, we mentioned a few resources that are locally there. We're all on our internet. If you have an internet, if you have a phone, there is an abundance of resources. And I'm going to go through just a few of them, and I'll put them in the chat box. One of them is BEAM. It's the Black Emotional Mental Health Association. Awesome group. They teach you about emotions. They teach you specifically targeted at minority, not just Black, not just white, it's minority disparities in health, disparities in everything, and including the LGBT, the cis, all of the categories that we sometimes forget about. The other one is Girl Trek. It's a national organization for Black women to promote mental and physical health, get to moving, get to knowing what your history is. And see, that's another part. It's understanding whatever culture that you come from, what your history is. We don't talk about medical apartheid, and it's not just about the Tuskegee experiment. It's about all the things. Sarah Bartmer. It's about Henrietta Flack. It's understanding why African Americans and minorities are afraid of the medical system. And to answer the question, well, why didn't they have testing centers in North County and North City until April? It goes back to understanding the history. So the first part of this is not just understanding anxiety and depression, but it is truly understanding the history that got us here. Because it seemed like the White House was just astounded. What? The Black community is affected more so? That was a surprise. That's been ongoing oppression, ongoing. Another one is Association of Black Psychologists and Association of Black Counselors. Now I say Black, but Black is including all minorities. These are organizations that are specifically set up, internationally, not just regionally, but we have regional subsidiaries of them. But they're resources that anyone can use. The one that I really employ everyone that's on this call, is to get on the internet and look at the Community Healing Network. They have translated in several languages how to do healing circles with the community. And right now we need a healing circle. A circle never ends and it never begins. It's like the Breakfast Club. We offer you what you need where you are. So the Community Healing Network comes out of California, and it comes out of the Association of Black Psychologists. Another one is the Black Women's Blueprint. and I keep saying women, Black women, Black women, Black women, a truly marginalized population. And that's a population that I work with a lot. So I have a lot of resources for that. But the resources that I'm talking about are for men, are for women, and are for all minorities. And that's sort of the reason why we're here today is to address the disparities. Now, to circle back around and talk about anxiety and depression, when we are upset, when we are traumatized, our body responds in so many ways. It lowers our immune system. The doctor was talking about our immune system being on alert. So all of that and understanding how you respond to a situation is the first line of defense. Understanding I'm in a community that has disparity. There's food deserts. Medication isn't available. Testing is available. So what are my resources? And the other thing is getting people to the resources, because sometimes they're not going to reach out. They're not going to reach out. So it's not just about the prevalence of anxiety and depression. It's about the whole person. So I didn't want to take up too much time, and I did want to point anxiety, but anxiety relates to everything else. You can't just look at one thing. You have to look at the whole person.
Great. Thank you so much for those resources. And if you could send those, you could put them in the chat, but also please email them to us. You can email them to me if you have my email address, or Marilyn Wilson. You probably have hers as well. And we'll make sure that we send those out to everyone whose contact information we have. I know it's right at 11, and I want to make, there have been a lot of communication, even in the chat box, which I love to see community partners and members connecting with each other and expanding the resources. If there are other questions or other community organizations or individuals who want more info, email PCAD, and that's P as in Paul, E, C-A-D, at Wustl, WUSTL.edu. And we will make sure that you get connected to the individuals or the organizations that you are looking for. Any last final comments from the panel members, either Mrs. Brown, Dr. Bullock, Dr. Kolditz, or Dr. Fields? Any final comments?
It was good to see so many people on this webcast, and the degree of participation and the broad views that were expressed. This was a wonderful, and the convenience of doing things over the web. I think this is the wave of the future. And why not do it more often? Obviously, there's more that people would like to talk about. So,
yeah, thank you for putting it together, and it's great to see some familiar faces, and look forward to seeing everyone in person, hopefully pretty soon too.
Yeah.
Great.
Thank
you all so much.
Yes, thank you. Thanks for hosting.
Thanks,
All right.
Bettina.